Joining us today is Dr. Soumya Swaminathan, former chief scientist at World Health Organization, to talk about the impact of the toxic air on our health, especially on children. Thank you, Dr. Soumya, for joining us. Doctor,
Good
according
evening.
to the World Health Organization, there is no completely safe level of air pollution. With that context, how serious is India's air pollution crisis right now?
We cannot overemphasize the seriousness of air pollution and its impact on health. In fact, there is a lot of evidence from the world as well as from India now that links air pollution to many different diseases and health problems. The WHO says that the safe air quality level is PM 2.5, that is the small particulate matters, very small particles, of less than 5 microgram per meter cube. In India, our national standards is set at 40, which is higher than even the intermediate standard of WHO. But unfortunately, even that 40 is not achieved by most parts of India, particularly the northern half of India. This is causing serious damage to our health and particularly impacted our pregnant women, young children, the elderly, those with underlying diseases. It is cutting many, many years from our healthy lives. And so I think it's a very serious health issue and needs to be addressed as such. It's the second biggest risk factor for our health today and is contributing to deaths due to heart attacks. And latest evidence is linking it with dementia as well.
Right. Dr. Soumya, we have linked air pollution with cardiovascular diseases as well as the respiratory troubles, apart from, as you mentioned, dementia as well. Do you think the prolonged exposure to this kind of air also increases the incidence of lung cancer even among non-smokers?
Indeed. In fact, we've made a lot of progress with tobacco control in India. That's been one of our, good success stories. But unfortunately, it's made up for by the increasing air pollution, because even people who are not smokers, imagine little babies exposed to the kind of AQI levels that we see today in North India. It's like smoking 20 to 30 cigarettes a day. Can you imagine what that is doing to your lungs? And therefore, lung cancer among non-smokers has gone up tremendously. And 1 in 3 deaths from lung cancer is now attributed to air pollution.
Right, right. Because Dr. Soumya, you are also a pediatrician. What do you think? What happens with the lungs of children when they grow up in this kind of toxic air and with such poor levels of air quality?
So the damage, unfortunately, begins when the baby is still in the womb of the mother. And studies from our own institutes shows that pregnant women who are exposed to these high levels of pollutants in the atmosphere have a higher risk of small for date babies, that is low birth weight babies, and premature babies. It impacts not only lung development, but also impacts the brain development. Now, in our country, many women are still using biomass for cooking. Even though the Ujjwala scheme did ensure that over 99% of households today have an LPG connection, the reality is that many poor households cannot afford the refills of the LPG gas cylinders, and therefore women are still using firewood, dung, and other materials for their cooking needs. Now, this creates a tremendous high exposure of women and young children, and therefore indoor air or household air pollution is another important risk factor that often is not considered, when we talk about clean air. And we do have a mechanism now, the Ujjwala scheme. What we need to do is ensure universal access to LPG by making it more affordable for the poorest households. Now, starting from birth, a baby is born with relatively large, small lungs, and therefore has to take many more breaths. And therefore, the exposure per kilogram or per body surface area is much higher for children than for adults, because they're breathing faster, they're also small and shorter, and therefore closer to the ground where the pollutants tend to settle. So for all these reasons, children get impacted more. And in fact, last year, about 170,000 deaths in children under 5 years of age in India were attributed to air pollution. So this is a huge, huge burden on the health of young children. Not only that, these children, as they grow, their body, because of the exposure to air pollution, is much more prone to infectious diseases. It's also much more prone to chronic diseases because it sets up an inflammation inside our system. So diabetes, chances of diabetes are more, chances of neurological diseases are more, chances of chronic lung disease is more. So we're setting them up for a lifetime of ill health. The converse of this, of course, is that if you invest in cleaning up the air today, you'll get tremendous health benefits. And the World Bank estimates that for every dollar invested, you will get $6 in return. So it's got a tremendous cost benefit of investing in clean air.
Doctor, what are the immediate measures that parents, schools should take to protect their children?
Well, this is a very important but a very difficult question because, individual protection in something like this means that you have to invest, for example, in air purifiers. So if you can invest in an air purifier, obviously, then that is going to protect you to a large extent. So if schools can do that and put air purifiers inside, that would be good. The other thing is to wear a mask. Now, you'll have to wear an N95 mask in order to keep these small, what we call the PM 2.5 particles out. So this is, of course, we did it during COVID, but, an N95 mask to wear it all the time is not really comfortable or convenient, and you do need to change the mask periodically. One can keep the windows closed so that you don't allow too much of the outside pollution to come in. But again, that's really not a very good, solution. You shouldn't be playing outside when the AQI is very high. Similarly, for adults, if you go out for a walk, one doesn't know if it's doing more harm or good. Wear an N95 mask if you're exercising outdoors. So the problem is that, individual protection, and of course, now a lot of doctors are telling people move away from these polluted areas. Now, it's not just Delhi, it's the entire Indo-Gangetic plain that is facing this problem. How can hundreds of millions of people move? That's not a practical solution either. So the only solution is to have an action plan, a Swachh Vayu mission, our Swachh Bharat mission that the Prime Minister launched in 2015 was so successful in expanding access to clean sanitation. And now we have the Jal Jeevan mission for clean water. We need a Swachh Vayu mission because this is going to benefit the health of, millions of our country people.
Right. We have been seeing the AQI hovering around 600, 700. Do you think this is a right time to recommend shifting physical classes to online mode for children? Do you think it will be a viable and good idea, or it restricts the physical activity of children as well? That is the one of the side effects of moving the classes to online. What do you think? What are the risk benefit analysis of yours on this?
See, one of the important considerations here is equity. We saw during COVID that when we shifted to online classes, the section of society which has internet, which has computers at home, which have comfortable house, which has people to look after the children at home, that section of society was fine. But millions of our country people who don't have those facilities, they don't have computers and internet at home. The whole family may have one smartphone at the most, which is with the father. The mothers have to go to work because in most families, both parents are working. There's no one to look after young children at home. So closure of schools actually is a retrogressive step, in my opinion, because it punishes those families and those children who come from the poorest backgrounds. They miss their school meals, they miss a safe and secure environment. So that is certainly not a solution I would recommend. In fact, we should do everything to make the environment safer so that children can have the exercise that they need, that they can have. It's a fundamental right, clean air. And it is so important for health. So I think that if we can look at it from a health perspective and we make the required investments into cleaning up the air, of course, interventions have to be in different sectors. We know it's not one source of air pollution, it's multiple, but it's doable. Many countries and many cities have shown that it is possible. And so I think it's a question of coming together and really implementing the scientifically developed plan and that will protect all our citizens, but particularly, I would say, for the next generation, for the children that are living today, it's really important that we do this as urgently as possible. As you said, the WHO says there is no safe limit. Of course, we are at a very high level of air pollution. So we need to set targets, intermediate targets. We can't go from 300 to 0 in 1 year, but we can cut by 35% in a matter of 3 to 4 years. That's what Beijing did. So we should be able to do that.
Right. Dr. Soumya, in past, we have implemented various strategies starting from artificial rain to stubble management to traffic curbs, but we have seen limited benefits from that. Do you think there is something that is missing from our strategy?
Well, I think, what's missing really is that there has to be a holistic plan, and then there has to be an empowered mission mode of governance that can implement that plan. And there's got to be, of course, the right financing behind that plan. So the National Clean Air Program really needs to take a fresh look. And the NCAP 2.0, which is being developed today, must embrace a much more ambitious, much more multi-sectoral, holistic, and an implementable plan with targets and how to get there. After all, nobody thought it would be possible, to achieve polio elimination in India because we had such a high burden. We didn't think it's possible to eliminate open defecation, but we've been able to do these things. So I think there is no dearth of experience in India to achieve very ambitious goals. And we also know from airshed analysis work that's been done by many, many groups that transport sector, the industrial sector, the construction sector, the household use of biomass for fuel, and of course, the agricultural stubble burning, which happens during a limited time of the year. So that only contributes, to the November air pollution. The rest of the year, we still have all of these other sources. So we need to have a plan to address all of them, like electrification of our public transport, improving public transport, reducing cars on the road, particularly in the central areas, implementing construction guidelines to keep dust away. So things like, the rain or spraying water, these are very temporary solutions, and they can only be done in a small geography. Here we're talking about the entire Indo-Gangetic plain. In fact, we're talking about even cross-border collaboration with countries like Nepal and Bangladesh and so on, which have the same problem. So it has to be a national plan. It cannot be for one city or one state. It has to be cross state boundaries, cross national boundaries. It has to be apolitical because this is about health that we're talking. There's got to be a good investment made in it because, as I said, every rupee invested is going to pay back, 5 to 6 times. Today, India is losing about 1 to 2% of GDP just because of air pollution.
Right. Thank you for the insightful conversation, Dr. Soumya. Thank you so much for joining us.
Thank you very much.